So this is the area where people are filling out forms. There are staff that are floating about to help anybody that needs assistance, either translation for Spanish, understanding the forms, or just general help. We're here to assist with that. So these are people that have finished their forms. Then we turn the corner is actually where people are receiving their vaccine. Today I have 13 stations, so at one time we can be giving 13 shots. Our goal is to have someone at that station for just 5 minutes and then have them move into the recovery area.
You'll also notice that back over on the east wall, we have some folks that are drawing the vaccines.
You take the red top off, and then once they put a needle in that bottle, it's only good for 6 hours.
So
which is where one of the challenges is with vaccine distribution, because we have to have 10 people ready for the vaccine as soon as we open that vial. You don't want to get to the end of the day and have 50 or 60 open vials and then waste vaccine.
Okay, so then after they're vaccinated, you'll see they get in a line and they queue up, and Katherine explained what we're doing after that.
So this is our observation area. Individuals are going to wait for 15 minutes. When it's their time, when the 15 minutes is up, they'll be called by one of the paramedics. Again, that's about a 30-minute process for those individuals that had appointments. And this is really why we need to do a walk-through clinic and not a drive-through. It's really hard to observe people in a car. So for anybody that can possibly walk, we really want them to walk through this clinic. It's much safer when we're administering this new vaccine. If staff sees somebody walking into the clinic and we can tell that they can't make it through here, they will be able to sit at these tables and they will have all the services will come to them. They'll do their form there, the nurse will come and vaccinate them, and then we'll observe them for their 15 minutes so they don't have to move through the building. And then we have very limited drive-up for people that cannot get out of their car, and we're doing that through the Civic Center garage right now.
We expect that this will be our large-scale vaccination center for all of January and February. That's as far out as we've planned so far. We would like to think that we would have enough supply to commit to doing this multiple days a week, maybe some in the evenings, and maybe even on a weekend, on a Saturday, just to try to make sure we're available to provide vaccines when people can access us. It's running very well, and we try to learn a little bit every day, and we've improved some things, and we'll keep working on that because we're going to be at this for a while, and it's very important that we get it right.